All right, earlier this week, more than 80 House Democrats signed a letter to President Joe Biden asking him to issue a national emergency in response to Roe's overturn. Now, 18 Senate Democrats also signed on to the letter. In their letter, they wrote this, quote, "The Supreme Court's radical and dangerous decision in Dobbs versus Jackson Women's Health Organization precipitated a full-scale reproductive health care crisis across our nation. It has also plunged our health system into a state of uncertainty and upheaval that threatens patients' lives," end quote. Wow, talk about hyperbole. So what would such a declaration do? Well, here to tell us about it is Roger Severino. He previously served as the director of the Department of Health and Human Services Office of Civil Rights under President Donald Trump. Roger, welcome back to the program.
Glad to be back, Tony.
All right. So, what would this do if the president gives in once again to the radical left and declares a public health crisis over abortion? What can he do?
Well, they are drawing at straws. Americans have voted for life after Roe v. Wade at the federal level, with the Hyde Amendment prohibiting federal funding of abortions to conscious protections. They have very little they could hang their hat on to say abortion needs to be required. So they're desperate to find anything. So now they're hanging on to this public health emergency idea, which is entirely backwards. Public health emergencies are designed to save lives, yet abortion is designed to end lives. You can't declare it a public health emergency based on a lack of abortion access. It's nonsensical to even think along those lines, but that's how radical this administration is. That's how radical Secretary of HHS Javier Becerra is. They see abortion everywhere, and they're trying to shoehorn public health and emergencies into their abortion agenda. I don't think it's going to work. And even if they attempted it, it would just be very limited in what they can do in terms of waivers of certain laws. We used it to good effect during COVID, but I just don't see how they're going to do it because they cannot fund abortion. Because, again, federal law says you can't direct federal money to abortion clinics. So the public health emergency, what are they going to do? Set up a FEMA abortion clinic in states that are pro-life? I just don't see how it's going to work.
So let me ask you this, Roger. So is this yet another example of the lawlessness of the left seeking to use government to accomplish what they want to do, however they can?
Right. I mean, they focused on the courts so much to further their abortion policy because they could not win at the ballot box. And that's what this uproar is about. The uproar is about the people now finally being able to vote pro-life. And in state after state, they're doing so. And God willing, we'll be able to do it at the federal level as well. Because they can't win at the ballot box. They went for the courts. Because they now lost the court, they're now trying to use whatever executive administrative power they have to try to create abortion on demand because that's what they want. Now, we have to resist their attempts of nullification of Dobbs, their massive resistance. I mean, this is the civil rights struggle of our time. And our country went through something similar where recalcitrant states resisted Brown versus Board of Education. It took 10 years until the Civil Rights Act. So I'm not shocked that the left is doing this and using whatever levers of power they still have, and they have it now. It's a federal agency. So HHS is ground zero. It should be the Department of Life. They're trying to turn it into the main funder and promoter of abortion, and it has to be resisted.
Yeah. And unfortunately, we've got many states that are resisting as well as many members of Congress, and I do think these are going to be election issues come this fall. I want to shift gears very quickly, Roger. Another issue that really involves the Department of Health and Human Services and the CDC. There is a website called Q Chat Space, and it aims to create an environment of, they say, learning and acceptance where LGBTQ plus teens can make friends and build community in a safe space. That's their own language. Now, this site, run in part by Planned Parenthood and featured by the CDC on their website, is advertised for young people between the ages of 13 through 19. 19-year-olds are legal adults. And there's no really tracking who gets on there. I mean, this could be a playground for predators, and we're funding it with our tax dollars.
It's sad to see that our science bodies and our government bodies, HHS, have been captured by ideologues. LGBT groups have been one of the primary funders of many of our federally funded programs. They've been receiving tons of money, and you mentioned Planned Parenthood as well, which has received hundreds of millions of dollars. And at Planned Parenthood, they're handing out prescriptions for sex change hormones like candy.
Right.
I mean, it's almost no questions asked. And my colleague, Jay Green at the Heritage Foundation, wrote a fantastic paper on the dangers not only of this cross-sex hormones, et cetera, but the fact that if in states that do not allow parents to have a say, the suicide rate goes up. Parents are key to making sure they're there to protect their children from people who would do them harm.
Right.
So-called bypass laws. The children could get these cross-sex hormones and drugs and even surgeries without their parents knowing. And that is a dangerous development that we're seeing now.
Yeah.
And the CDC should not be doing anything to further a wedge between parents and their children.
Yeah, you're absolutely right. Roger Severino, always great to talk with you. Thanks so much for joining us today.